Hey everyone, so I am just recording a short video to let you know about my cancer journey. Not the most pleasant subject to talk about, but because very few of my friends know what's been going on, I thought I would just post a short video rather than explain it individually to various people. But I'm 44 years old and I'm currently dealing with my second bout of cancer. So this all started about a year ago, around March or April. I noticed a small spot on my face, which is now gone, but it was right here, a unusually shaped mole that appeared to be growing by the month, just a tiny bit. And I hadn't remembered seeing it a couple years earlier. So I had it checked out. It was on May 14th, 2018 that I had a biopsy done. So the mole was cut out, what looked like a mole, and it was sent off to the lab to check it. So 2 weeks later, it was on May 29th, I got my test results back, and the lab confirmed that I did have cancer. I had melanoma. The spot on my face measured to be 0.44 millimeters thick, so it was stage 1A melanoma cancer, and I would need surgery to remove it. Fortunately, I did catch it early by doing a self-diagnosis, so that was really critical as far as not having a much worse stage or having it spread throughout my body. So on June 12th, I did have surgery to remove it, and this is a year ago, June 12th, 2018. And the surgery itself, I was awake, but my face was greatly numbed, and it was a stressful experience, but I didn't feel any pain. I couldn't see what was going on. Just listened to the doctors talk and smelled some odors from the surgery, but that was about it. So it was removed and I was out of there. And then on June 15th, 3 days later, I got a call. It was confirmed that the surgeons got clear margins. So they were hopeful they had got all the cancer out of my face and it had not spread to my lymph nodes or other parts of my body. So my face recovered slowly. It's still healing. As you can see, I have a noticeable scar that will be there for the rest of my life, but I was well enough. So actually a few weeks later, I was able to travel to Greenland and go backpacking for 100 miles with just keeping a slight bandage here, which eventually came off, and I had no problems with infections or anything. Backpacked 100 miles in Greenland with my friend Josh, and there were no issues. So anyway, fast forward a year later, that was the end of July 2018. So the end of July 2019, I had noticed a small bit of abdominal pain that was very light. When the doctor asked, I said it was a 3 on a scale of 10. But because I had had melanoma, I'm very in tune with my body. Anything that seems out of place, I get checked immediately. So doctor went ahead and ordered a CT scan. So my original pain turned out to be probably nothing, maybe a work-related strain, but the CT scan did not reveal anything related to that pain. However, I did get a call with some bad news, and that was that the CT scan, which covered my entire abdomen area, the lower half here from my heart on down, was checked, and a tumor was found on my left kidney measuring 6.3 centimeters. And this was likely diagnosed to be kidney cancer stage 1. So the tumor was on the bottom of my left kidney, and the only positive thing out of that was that I did catch it early by having the CT scan done, which revealed this because it checked all those parts of my body. And the location of it was on the bottom of my kidney. So this was a good location to have surgery performed as far as being able to save most of the kidney and that kidney's function. So, but I was told there was an 85 to 90% chance that this is kidney cancer, renal cell carcinoma, and just a 10 to 15% chance that it's not cancer. We won't know for sure if it's cancer or not until after the surgery and it's tested in the laboratory. But due to various reasons, a biopsy is not going to be performed, but we're going to go directly to surgery. And that's because the biopsy is notoriously unreliable and carries its own risks. So it just doesn't make sense to me or to the doctors. But I was told that I was very fortunate to catch it by pure coincidence before the tumor got larger or perhaps invaded the other areas of my body. And the doctor estimated that it may have started in my kidney about 5 years ago, and we just don't know the cause, so there's no reason to speculate on that. But I did have a bit of good news, which hopefully will stand the test of time, and that's that the blood work and chest x-ray, as well as that CT scan, revealed no cancer in other parts of my body that was visible. So the liver, my other kidney, my colon, my heart, my lungs, various areas were checked, and there was no sign of cancer. So that's where we get the stage 1 potential diagnosis once it's confirmed to be cancer. So as of now, surgery will be performed on October 25th, although I've requested an earlier date. We'll see if that works out, but there's about a 2-month delay for these surgeries. And it'll be a robotic surgery done in San Francisco. And we'll probably require a 1-night hospital stay at the least, perhaps longer, depending on how well I recover after the surgery, and perhaps 2 to 4 weeks off of work to recover at home. And again, the surgeon will try to save the left kidney and just do a partial nephrectomy, which is cutting out the tumor and some healthy tissue around it from the kidney, and then pulling that out of my body for testing, closing the kidney back up to prevent blood loss and help it heal, and hopefully that kidney will remain functional, which time will tell. Now, of course, this is a major surgery, so there are risks that are associated with that, with all major surgeries like blood clots, stroke, heart attack, damage to other organs and blood vessels, pneumonia, just to mention a few. But this surgery is my best chance for a cure, so I'm certainly ready and willing to have it done, and hoping for the best as we approach that surgery date and time goes by. But again, I have no symptoms at all of this kidney tumor, so nothing that is usually associated with having kidney cancer, and that means hopefully that I caught it early and I can go about my life. Our family is preparing to spend some time together in Fiji, so I'm looking forward to that. Assuming I can't get an earlier surgery date, then we'll go ahead and travel to Fiji and enjoy some time there together. But just so that kind of summarizes, that's a full update of where I've been in my battle with cancer, melanoma, and now what is likely kidney cancer. So anyway, I will try to post another update at some point in the future. Thanks for watching.